very special day today. As you know, the Human Rights Council has been debating the rights of all the women in the morning. It was very clear that one of the, let's say, one of the less taboos was violence against women this morning. A couple of missions mentioned it, some of the speakers mentioned it also. So I think that it wasn't pre-planned, but I think this event really follows suit with what happened this morning also in the Human Rights Council. So we are here together now to discuss, to evoke the World Elder Abuse Awareness Day, and the focus this year is on violence against older women, the last taboo. And I think it's very critical that you call it the last taboo, because one of the big claims we had, one of the asks we had this morning from the council and from the panelists who were sitting in the annual day discussion was visibility, was to provide data, was to bring the attention of the issues to policymakers, and for that, the first thing you need to do is to do events like this and events like you did in the morning. You cannot act if you don't know what's happening, and for that you need data, you need political attention, and there's not a better space to do that than the Human Rights Council and all the events that are organized around it. I would like first to call your attention. I know that all of you know this because you all came to the event, that this event is co-sponsored by Argentina, Montenegro, Uruguay, the Office of the High Commission for Human Rights, the Independent Expert on the Rights of Older Persons, UNFPA, WHO, as well the NGOs Committee on Aging from New York, Geneva, and Vienna. The World Elder Abuse Awareness Day was designated the 15th of June and was initiated by the International Network for the Prevention of Elder Abuse in 2006, and it was later recognized by the UN as an international day by a resolution of the United Nations adopted in 2011. We know that elder abuse is a serious global public health, economic, and social issue. It's a long-hidden taboo. Elderly abuse takes the form of violence, abuse, neglect, exploitation of older women and men, and it's systemic. It's a human rights violation rooted in gender norms, sanctioned by harmful cultural and traditional practices, and fueled by ageism. It is hidden as the last taboo, and the international community has affirmed this also in a resolution by the General Assembly. We have some data, although this morning it was very clear that we need more data. And what the data shows us is that, and I'm going to quote data from WHO, is that one in six persons over 60 is suffering from abuse. This means 141 million people worldwide, 60% of older people were abused last year. Elder abuse is recognized globally as a serious problem, yet there's little evidence on the overall prevalence and even less evidence on what works to address it. Only 41% of WHO member states report having a national action plan for preventing elder abuse. And as a statistic, a forecast that we have, only 4% of elder abuse is reported. Today, we want to shed light into this data. You want to bring this to everyone's attention. And this is why we have an esteemed panel with us to discuss this year's International Day theme. It's access to justice, social and legal, social and economic services for all the victims of sexual, physical, and financial crimes. But first, before giving the floor to the panelists, let me give the floor to member states for opening remarks, and I will start with His Excellency, Mr. Milorad Šćepanović. It's all maybe you know it. So you can admit it was very bad. The ambassador of Montenegro, Your Excellency, you have the floor.
Thank you very much, distinguished friends, colleagues from composed countries and institutions, and distinguished panelists, excellencies, ladies and gentlemen, friends of elders. It's my really great pleasure and honor, and allow me that I can also say that as my country's group of friends, that I would like to greet you on behalf of a group of friends of the rights of older persons and my own behalf. This is a very timely discussion, a moment to capture and evaluate what has been done in general in the area of dealing with the violence against women at the international level, mainly within the UN framework where the story had started. Yesterday, during the Human Rights Council Cluster Dialogue session, we had an opportunity to listen about the achievements of the 25 years of the Special Representative of this issue. Maybe today is natural to recognize that the violence against women is the human rights violation, but that was not the case only 2 decades ago. Since then, a lot has been done to promulgate women's agenda in other UN policies and mechanisms, and that in all contributed to the raising of awareness on the importance of protections of women's rights. Therefore, we should cherish all the achievements and have in mind that the work is never done, that the process is ongoing, especially with the view of the overall drop in respecting human rights and the global level we are witnessing today. All those achievements have brought us to the level of discussion the specific rights of older women and to start viewing their individual rights through the human rights spectrum. Many initiatives have been conducted both in Geneva and in New York with the open-ended working group on aging. Now there is an awareness that this is a cross-sectoral and multi-sectoral stakeholders area. We see greater engagement of national institutions and civil society as well. In the light of the World Elder Abuse Awareness Day, it is a time to talk about the most sensitive issue when it comes to all older persons. According to the WHO, what the distinguished Madam Chair mentioned, we have also some data, approximately 1 in 10 older persons experience abuse every month. It comes in different forms, physical, psychological, financial, as well as neglect across different social, economic, political, and cultural contexts. And it is still a taboo, as rightly recognized in the concept note of this event. Elder abuse has a face, and the gender aspects of elder abuse and violence are too often obscured. It is very difficult to trace it, as it often remains hidden within families. In addition, there is a lack of awareness of the existing legal rights and mechanisms. That is access to justice in general, which is followed by the fear to report abuses, shame and fear, particularly on sexual offenses. This is what we have been witnessing at the national level as well. And we are thankful to the independent expert Rosa Kornfeld-Matte for visiting Montenegro and helping us to recognize and improve our work on application of the standards for better functioning of the overall system that will protect and promote rights of the older persons. Visible results have been particularly achieved in the area of care by opening new retirement homes, daycare centers, and in palliative care via gerontological nursing. Although we all have to work to strengthen domestic legislation and apply better practice, especially when it comes to autonomy and independence of older persons, as well as their effective access to justice, we need to think about further action at an international level. We need to initiate the prohibition of age discrimination and explicit protection against violence, abuse, and neglect in international human rights law. They are now visible in treaties that applies to older persons, but more is necessary to be done when it comes to international universally applicable standards. Maybe the time has come to make further efforts in promoting a new legally binding instruments, although I am aware that this can be long and demanding process. Still, I think the right to full, effective, and meaningful participation in all aspects of life of all persons should be our end goal. In the upcoming period, we should dedicate our attention to achieving it. I thank you.
Thank you very much, Mr. Ambassador, for your commitment. It's very clear, and also for highlighting what should be the road ahead, not only according to your national perspective, but also according to the evidence that we we've been gathering, and also for being very straight and very blunt. The fact that sexual violence, it's the most heathen within the heathen violence against elder abuse. Thank you so much for that. And now I'm going to pass the floor to our distinguished, and this name I can say, Alejandra Costa. She's the Deputy Permanent Representative of Uruguay in Geneva.
Thank you.
There we go.
There we go. Well, of course, just let me share my excitement for being here with these distinguished panelists, and of course, I'm pleased to share also the opportunity with to share this moment with Rosa, even if it's just virtually, with Rosa Kornfeld-Matte, the independent expert on the enjoyment of all human rights by older persons, who has recently actually visited Uruguay also, and will be presenting her report in the next council session. Uruguay is glad to co-sponsor, of course, this event, and I would especially like to thank the member states of the Group of Friends of the Rights of Older Persons for their important common efforts to advance human rights of older persons, including older women. We are strongly committed to fighting all forms of violence against women at every stage of life, including the gender-based violence older women are subject to. As you very well know, globally, older women experience all kinds of discrimination rooted in gender norms and cultural stereotypes that emphasize women's role as child bearers, which can easily lead to the harmful assumption that older women are useless when they are past their reproductive age. This event is a positive sign, we believe, that we are moving in the right direction, and shows that exclusion of older women from advocacy for the rights of women and girls is starting to change. And that, step by step, of course, but we are beginning to becoming taboo surrounding the gender aspects of abuse and violence against older persons. Let me briefly share with you two concrete national measures that Uruguay has taken at national level. Since 2013, our older persons national institution, that's called the Institute of Older Persons, the Instituto de Mayores, operates a service for victims of domestic violence with a focus on older persons. It monitors situation of abuse and mistreatment of older persons and contributes to the protection through a comprehensive approach of specialized technical teams which provide direct attention as well as psychological, social, and legal advice. As acknowledged by the independent expert in her country visits report, the implementation of the Service of Attention to Domestic Violence, that's the service called, is a fundamental step in addressing elder abuse, including to raise awareness of society as a whole. The second milestone in Uruguay was a law on gender-based violence against women that had the purpose of guaranteeing the right to a life free of gender-based violence to all women, regardless their age, sexual orientation, or gender identity, or of course any other criteria, without discrimination at all. The act that took a long time to be approved recognizes and includes the different types of violence, physical, psychological, and emotional that women may endure, and puts in place mechanisms, measures, and policies for prevention, care, protection, punishment, and redress too. I have to be honest with you, the law is really good, but our challenge now is to get to the point to a real and pragmatic implementation. Despite government and civil society efforts, gender violence, including against older women, remains unchallenged in Uruguay. In this regard, we count on Rosa's country visit report recommendations to help us move forward. And that would be very complete. It's true for today. So thank you.
Thank you so much also for a very clear commitment and for helping us today to shed some more light on this specific form of violence against older women. And I think that now we are ready to pass the floor to the panelists who are going to share with us some of their experiences, but also some of their expectations from this discussion. I don't think that we need to introduce them more than to say that the first speaker is Mukuka Nambeya. She's a senior advisor to the Stephan Lewis Foundation Grandmothers to Grandmothers campaign. She's working with African and Canadian grandmothers alike to strengthen the bonds of solidarity. She's a passionate HIV activist and a gifted counselor based in Lusaka, Zambia. Ida, the floor is yours.
Thank you. Good afternoon, and thank you very much for according me the space to come and share on behalf of the African grandmothers. I think we are all familiar with the story of HIV and AIDS in the sub-Saharan Africa. We are talking of the women that stepped in to take care of their grandchildren after their children died of AIDS. A lot has happened, and these women have become vulnerable and affected by the pandemic. I will share some of the things that happened to these women. The land rights. When the grandmothers lost their children to AIDS, and when their husbands died, the families would tell them to leave their places because they don't belong there. And this is a place where sometimes grandmothers had lived all their lives, probably 50 years, and you are told to leave. And not only that, the issue of wife inheritance. Whenever you lose your husband in some parts of Africa, and I'm talking about Kenya, you will have to be given another husband. And these grandmothers went through a lot. They would be given another husband, and that husband would die. Probably they are HIV positive, and at the end of the day, they are told actually to leave the community. They are called all the names. They say they are witches, and they are not fit to live in those communities. In 2003, the Stephan Lewis Foundation partnered with more than 325 organizations that saw what was happening to these grandmothers. Before, nobody knew what was happening to these grandmothers. They were blamed, they were called names, they were bad women, but nobody knew what was happening until when the community-based organization brought this to light. And the Grandmother to Grandmother campaign was born to continue helping raising the awareness and also raising the funds to continue supporting the grandmothers. And after the grandmothers were brought together, that is when the strength came in. Before, each grandmother was living in isolation. They accepted the blame that they were bad teachers. But after these grandmothers were brought together, counseling started coming in, and they started introducing them to skills. That's when the grandmothers got in the strength. They started to voice out. Now they started to think it is not our fault that our children died. We've actually given a good service to our countries, and that is when now grandmothers started coming together to form strong movements. They've had different gatherings around Africa, in different parts of Africa, where these grandmothers now are saying that we have to be given what belongs to us. We really need our human rights to be given to us. We need healthcare to be looked into. We want our pensions. We want to be paid for what we have done. I have to say that with my experience of going out in different African countries, I have seen that some countries actually do provide the pensions, but when you actually go on the ground, it is a different story. This pension doesn't really come to what it is supposed to be. I remember a story of one grandmother who said, wow, I didn't know how to read. Every time I was given a paper of a pension, I just got it and got the money. And now that she went to school and she started knowing how to read, one time she was given a pension slip and she found out that on the pension slip, they had cut a television provision. And she told herself, she said, I don't watch TV. How come they've cut out the bill on the TV? And now because she knew how to read, She went back and said, how come you cut this television bill? Because I don't have a TV in my house. And now government was starting to know that these grandmothers are beginning to know what belongs to them. You don't need to joke with them. And we have seen that some of the grandmothers now are running for offices. The grandmothers want to sit on land rights now because they know that they really need to be there for their own rights. And all these things in Africa are coming out. As a person that was there to see these people mourn their children when they died of AIDS and seeing where they are now, we see that there's a light at the end of the tunnel. And all I can say is that the African grandmothers need to be given what belongs to them. Every time I go to the communities, the grandmothers say they need to give us our rights. Nothing about us without us. And for them, that saying seems to be something exciting because they want to be involved. They are loudly saying it, we want to be involved in the decision making. You should not decide on our behalf. And we should be visible. You should see what we are doing. And I think this is all I can share this afternoon about the African grandmothers. Thank you.
Thank you so much, Ida, for sharing your personal stories, your personal experience, and to show how you can inspire the whole community, how you can inspire change. And also the story that you were sharing about running for office, running for political decision-making spaces, that's very critical because there's a clear link between presence and relevance. So if you are in the decision-making spaces, you have a voice, you have the power to influence the decisions, and also it's very clear that if you engage older women in program designing, the programs will actually respond to their needs and not to what others think they actually need. Thank you so much for this. And now sorry, I need a technical break because I jumped the part that you were reading, the declaration from. Okay, then we go through sorry. I didn't follow instructions. That was the problem. Sorry, Sylvia. We do it after. Thank you. I'm saying, Ceci, thank you. So we're going to go to the second presentation, and we're going to start with a video. The video. I have the video.
Lowenstein-Lazar, and my talk today is about a group of women, older women, who are victims of sexual violence, but are almost Hello everyone, my name is Dr. Ruthy Lowenstein-Lazar, and my talk today is about a group of women, older women, who are victims of sexual violence, but are almost invisible in legal research, in legal activism, and in the criminal justice system. My talk is based on a research that explores a topic that has been neglected in legal scholarship and offers a new empirical legal account of sexual violence against older women. To achieve this end, I have searched more than 1,000 American cases. The final empirical basis includes 107 cases describing some form of sexual violence against women of the age of 60 between the years 2000 and 2018. I will introduce some of the findings and will share with you some of my thoughts regarding these findings. The full research is going to be published in the Michigan Journal of Gender and Law. The main picture that we see is the stranger rape scenario. 68% of the cases introduced rape that was perpetrated by a stranger, usually in the context of home invasion, battery, and robbery. The majority of the cases include extreme and brutal physical and sexual violence, so brutal that 28 victims of 147 victims died as a result of the assault compounded by their age. Only 12% of the cases introduced acquaintance rape. Only 18% of the cases introduced rape in institutional settings perpetrated by another care provider or another resident. Not even one case of intimate was perpetrated by an intimate partner. So what does this picture tell us? What are the cases that get to court? Or more importantly, what are the cases that do not make their ways to court? The main cases, the cases that make their way to court, are the stranger rape cases. Why? First is the existence of physical violence. Physical violence provides corroborative and physical and very strong evidence. That way, these cases are easier for the prosecution to proceed to court than not a word against word scenario. Second, the power relations between the victim and the offenders were much younger and stronger than them. The third reason is the fact that rape myth and stereotypical perceptions of rape and rape victims are just not part of the picture. We do not suspect these older victims to provoke the sexual violence in any way. Consent is just not part of the discourse. So these are various reasons for the dominance of stranger rape cases in courts. Conversely, rape in institutional settings is hardly noticed. Why? Well, many of these victims suffer mental, physical, and physiological disabilities. They have a hard time verbalize what has happened to them. They have a hard time saying no to the sexual assault. There are no witnesses to see the sexual violence, and these victims do not have a voice to make in court. Rape by an intimate partner, although it is the most prevalent form of abuse in criminological and sociological and gerontological research, is just not visible in the legal picture of sexual violence against older women. It is underreported, underprosecuted. So despite findings indicating that sexual violence against older women creates serious consequences and is a serious human rights violation, it is hardly noticed by health professionals, social workers, legal professionals, and society at large. It is being noticed when it fits the real rape scenario, when the victim is the ideal victim, frail, innocent, very old. But what about the other cases that are not just not noticed by the criminal justice system? Scholars and policymakers should consider the interplay between age and gender in framing this phenomenon, conceptualizing it, and treating it accordingly. There is a need for a holistic approach to sexual violence against older women. There is a need to provide legal and social mechanisms to these women that will fit their needs both as women and as older victims. Thank you very much.
Professor Ruthy Lowenstein-Lazar. She's the head of the clinical center. She's the head of the Center for Clinical Education, and she's a lecturer at the Haim School of Law in Israel, and she's also a visiting scholar in Colombia. As you saw from her remarks, she's been focusing mainly and doing research on gender and criminal law, violence against women, sexual violence, with a focus on consents and victims' rights. Therefore, the focus on institutionalized people, and also in clinical education and law and social change. And she brought to us a very stark image of what happens when, in our lack of response to victims of rape, especially when they are institutionalized. But we can see as one of the first steps to also bring visibility and attention to this deeper problem that this is clearly the deepest taboo in all the violence against older women. And without further delay, I'm going to give the floor now to our third speaker, José Ferreira-Alves. Is Portuguese. Just by the way I can pronounce his name, it's very clear. He's a professor in the School of Psychology in the Universidade Minho in Portugal, and is going to talk to us about the meanings of abuse from the older women's perspective. He's an assistant professor at the School of Psychology, University of Minho, and he coordinates a research group on adult development and aging. One of the global projects that José Ferreira-Alves has been involved, it's on regarding elderly abuse in a global perspective, and the project is titled Personal Development Predictors of Older Adults Abuse and Neglect. José Ferreira-Alves, professor, you can say much more about this.
Thank you, Mari, for your presentation. I want to bring gratitude to this invitation to Susan Summers, President of Nambeya, to be here today. And I want to bring some issues respecting the meanings of abuse from the older women perspective. This is not new. Sylvia has published in 2002 Missing Voices that focused on the same thing, on the same topic. But I want to bring this issue again and also talk about the definitions of abuse and the measurement of elder abuse. I will present you a very small part of research conducted within my team at the University of Minho. We should state that we are not completely satisfied with the typologies of abuse proposed by several organizations. We are satisfied with the global definition of elder abuse as something that causes harm and distress and is perpetrated by those that older adults do not expect and trust. We think that we should do a different kind of approach that brings the meanings that experiences of abuse have for older women and older adults. We have a lot of knowledge of abuse as defined by specialists. This knowledge was created by individuals and organizations as Nambeya and WHO, and adopted by them and by many others that use them in order to prevent and treat elder abuse. Therefore, we should monitor, in my view, if what we already know about the harm and distress abuse causes is really what older persons identify as abuse. So this research project departs from the feeling that we need to hear carefully older adults in order to understand what experiences of abuse they have. It is in some way incredible that we continue to hear presentations and presentations and presentations about the typologies of older adults' abuse and feeling that they do not add anything more than what we already know about abusive experiences of older adults. It is time for adding to those typologies a more grounded vision of what abuse is for older persons. We depart from this the definition of older adults abuse, and we know that this definition is this formal definition has been operationalized by these typologies: physical, emotional, neglect, sexual exploitation, and so on. So we depart from a different view. We depart from the same definition, and we went to older adults, to a very small sample of older adults, 27 persons, and we have to quit 8 of them, and so we have only 19 in the final. And we asked them, can you give me an episode in which someone in who you trusted caused you harm or distress? And what we found was mainly this that I will present you. This is the main issue of my presentation. So, as you can see, the breach of trust is the main topic that the narratives bring to us. This breach of trust is was referred by 63% of interviewees, and is relative to mainly to what relative to the fact that children does not incorporate between their objectives of life, the objectives of life of their parents. The second most important issue that we found was the feeling of being excluded from conversations, meetings, decisions, and so on. That and in this category, we found two kinds of exclusion. One exclusion that was completely unacceptable for the older adults, for the older women, and another one that was in some sense acceptable. For instance, being excluded because the person is not able to walk, and so when someone organizes a walking travel, do not invite them to walk. So, but even in these cases, older adults wanted to be hearing about that. Another important point of this finding was depersonalization. These were narratives of intense emotional, emotional feelings reported, because people were treated as if they were not persons. So and it was mainly relative to persons that were in institutions, not in the family institution, but in social institutions. And I call them depersonalization because people seems to be not themselves when they experience this kind of experience. Another kind of finding was aggressivity. Physical aggression, that is related to physical aggression. Another with financial restriction is not financial abuse, but financial restriction. So women does not have enough money to manage their daily life. And another one that was not related to interpersonal persons within the closed cycle of the person is disrespect that were related to experience that look like bullying in social meetings. So we have to close this, and I just want to take this final note. We are constructing now a new measure taking into account these categories, and then when we have that measure, we go again to older people to see if this scheme can be supported. But we can already be sure that older women and older people make sense of harm and distress from known persons in a different way of actual operational definitions. Older people do not have the schemes of physical, emotional, sexual, financial, but instead they place these occurrences in their own categories of meaning. And these categories of meaning must be understood and reported and being subject to measurement if we want to measure harm and distress. Thank you.
Thank you for all this very interesting analysis and methodologies. They challenge a lot some of our former perceptions, but I think, and I'm saying something that wasn't agreed, I think that if we reach out to you and to Sylvia and to Susan, we can maybe have access to some of your findings so that we can also follow the discussion, because it's 7 minutes it's too little for the amount of information you had to share with us. But thank you for being flexible on this. So all of us reach out to Susan Sylvia, and she will make sure that we get more information from José, but we still have the Q&A period. And now, last but not least, I'm going to pass the floor to Lale Sai. She's the coordinator for adolescents and risk populations at the Department for Reproductive Health and Research in the WHO organizations. And I think that among many things, Lale is going to talk to us about reporting on violence against women in the SDGs indicators and the amazing work that WHO is doing in that field.
Thank you very much, Monica, and thank you very much to everyone for being here. I'm very happy on behalf of WHO and our UN partners to share some of the work we do in terms of improving the data availability and the quality in relation to violence against women. And happy to also discuss some of the gaps that are existing. Maybe at the end of this meeting, we will all have an idea to what we individually or in our institutional capacity can do to fill those gaps. Just in terms of from the SDG context, as you know, Sustainable Development Goals, SDGs, accepted by all of our countries in 2015, for the first time included targets and indicators in reducing violence, the prevalence of violence against women. And we have two indicators in the SDG framework where the countries are reporting, but also we as the UN organizations, WHO together with UNFPA and UN Women, gather data from all countries, all surveys that are available, do some methodological and statistical work to analyze these data and come up with regional and global estimates in terms of the prevalence of violence against women. Just to remind to ourselves and also to those who do not know that these two indicators are number one, the 5.2.1 SDG indicator is really looking at the proportion of ever partnered women and girls aged 15 years and older subjected to physical, sexual, or psychological violence. The other indicator, 5.2.2, is the proportion of women and girls aged 15 years and older subjected to sexual violence. I'm repeating these indicators here because, as you just heard, these are 15 years and older. So this, in terms of measuring these indicators and reporting back to the world, we are, as I said, we are compiling all data available, especially from population-based surveys, national surveys in countries. But again, many of you will know, and especially the experts in the panel, many of the data we have, population-based data we have from countries just finish end measurement at the age of 49. So actual SDG indicator is really 15 and older, but we have data, most of the data is really up to the age of 50. So that's one big gap. I think we all have to advocate to fill this gap. Many of the data we have comes from the demographic and health surveys that are predominantly conducted in Africa, in Asia, in middle and low-income countries. They finish the measurement at the age of 49. So that's one important gap we have. In terms of reporting as part of SDGs, we now have data, good data from 151 countries on violence against women, but again, I'm saying up to the age of 50, not over the age of 50. Very few countries have that. So that's one highlight I would like to, while we are improving the work on this data availability, we should really advocate for getting data for older women. The second one I would like to highlight, the second gap is, again, Professor Ferreira-Alves very eloquently mentioned the types of violence that older women are different than the types of violence, not totally different, but there are different aspects like financial violence, like depersonalization, etc. So in addition to improving the data availability, for older ages, we should get more standardized, better measures to how to measure the violence on older women. And again, we as WHO, while improving the data, we are also trying to bring what is available in terms of methodologies. And again, very happy to hear from Professor Ferreira-Alves that a lot of thinking and theoretical and operational thinking went into this. So we have to come up with, together with partners, to really have a standardized instrument that can help measuring the other types of violence against older women. So we, at the end of the day, we all measure the same thing. And I'd like to finish what Monica had started at the beginning of this panel, that what gets measured gets done. Unless we measure the issue at hand, the issue we all believe is so important, in a standard way, comparable across settings, across countries, we won't be able to see where our efforts are going. So hopefully this will be, before finishing, I just want to mention that it's great that these issues are being now surfaced and highlighted much more commonly, and then I hope we will have better progress in the coming years. Thank you very much.
Thank you very much, Lali, for updating us all on the efforts and also on the gaps. I think this is something that we should all keep track, because it has to do with planning, it has to do with responding, and data is the new golden standard for whatever we try to do within UN. And now I would pass the floor to Sylvia. Can we do it now? Sylvia is gonna read a part, an excerpt from a statement from Rosa Kornfeld-Matte. She's the, as you know, the independent expert on the enjoyment of all human rights by older persons, and Sylvia is going to read one extract of her message.
Yes, she was very sorry that she couldn't stay in Geneva. She was here last week and she lives far in Chile, so she issued a press release, and we agreed that she wanted this to be part of the message. And she says, sexual abuse and rape of older persons is still a taboo. It remains largely unreported and undetected and thus invisible. With the aging of our societies, this problem is expected to grow dramatically. However, without enough data, statistics, and studies, we will not have even an estimate of the dimensions involved. One of the challenges of sexual abuse is the perpetuation of the myth that strangers predominantly perpetrate it. Sadly, most abuses are family members, relatives, or other confidants, typically in caring positions. This explains the inherently sensitive nature of the issue. This myth is sustained by a societal attitude that does not accept the concept of sexuality in older age, and therefore the idea that an older woman can be targeted because she is a woman. Negative stereotypes such as that older persons aren't sexual beings, their greater dependency on others, potential divided loyalty to staff members or residents are unique barriers to reporting, detecting, and preventing sexual assault in nursing homes. Despite severe health consequences, efforts to prevent and address abuse remains inadequate. And I will stop there. Thank you, Monica.
This was part of the message that I think raised the attention last week. I saw it being reported, I saw it being reflected in many media, in many newspapers, showing that some of us were caught by surprise, but also that some of us were not aware of the level of violence we are discussing and we are covering here. And it's the discussion is very interesting, and I was sharing with Sylvia something from my previous life when I was in politics, that when we started to do campaigns in Portugal on violence against older women, we started by economic violence. We started by what José was mentioning, by controlling the financial autonomy of older women. And I remember that in one of the discussions there was a group which included me also, that we wanted to move also to violence, physical violence, do some research on rape, on try to come up with a narrative that didn't show women as victims, but women as survivors. Also, because I think, and this morning it was very clear, the perception and the narrative around the human rights of all the women needs to be more positive, in the sense that needs to be inspiring or aspirational in that sense. And I remember that there was a huge resistance, which actually means, this was about 10 years ago, but this actually means that in several even civil society organizations, there's still a long way to go, and I think that events like this can really bring attention and can really show that we want to listen, we want to know about it, we don't want any more taboos. So again, thank you, Sylvia and Susan, for putting this together, because it's really gonna be a milestone in the discussions within this council on how we see also the rights, the human rights of all the women. But it wasn't to listen from me that you came, and we all now want to listen from you. And we have time to take some statements, some questions to the panelists. We already have a volunteer.
Thank you very much. I'm Alejandra from the Gray Cells Association. And yeah, I think I found it very fortunate that one of the co-sponsors of this meeting is Uruguay, because I would like to mention a very successful approach that they did on social security that I think that could be done in the case of abuse to older women. The violent people in the year 2030 and 2040, they are in elementary school now. So we have to teach them at school now, as they are doing in Uruguay, that social security is good, that violence is bad, that you need to pay your taxes. So in all the civic activities at the elementary school, this should be put into their chip, so that slowly this goes down. So to me, that's a key issue, just prevent them in the future. And just one question, possibly a professor could expand this. I found that 19 interviews, it's very interesting, but it's a very small sample. I was wondering if in a larger sample you could have some conclusions on educational level and the impact of it, of income level, and a very strong difference that I have found in many activities is between urban and rural populations. So are you planning to expand your sample and approach these issues? Thank you.
Thank you very much. I see Slovenia.
Thank you very much. Just very quickly from our side, I mean, we'd really like to thank Argentina, Uruguay, and Montenegro for organizing this, and the engine behind it. Silvia, thank you. Thanks also to you. We, as you know, we're co-chairs of the group of friends of older persons, of rights of older persons, and we're engaging very much. We're a little bit concerned every now and then, walking into these type of events and seeing that there is not a lot of attention given to this issue, and it should be. I mean, we learned today in the plenary of the Human Rights Council that this is a pertinent issue and we should be addressing it. I know that there's, of course, always need for additional data, but I think it suffices already. We're at a stage where the data suffices and basically says that something needs to be done on a global level to address these issues. So basically, I mean, from our side, I mean, I have also intervened at the meeting earlier today. For us, avenue that's worth pursuing is, of course, having a legally binding instrument that would address rights of older persons. My question would be basically to the panelists: how could we achieve even greater attention for this issue? I mean, yes, we're taking it to the council. Yes, we have open-ended working group in New York meeting every year, once a year on this issue. How can we move forward on this? And then secondly, in terms of Slovenia, we are, I think, one of the countries that does really does address the issue of the gender pay gap in fair manner. We have one of the lowest ratios of division between men and women on this. But when it comes to older women, it increases. And I think, I mean, this also opens up the older women to all types of violence, which can be going against them. So basically, we as Slovenia, I mean, we're trying. We have, I think, right now a new sort of a strategy addressing this issue. But it's always good to have exchange also on these issues. In this sense, I also very much welcome this event that I'll be reporting on back home. And thanks again to everyone.
Thank you very much, and for the specific commitments, but also for the will to engage. And I have no requests, but now I'm going to pass the floor to Brigitte Slip from HelpAge International. I'm sorry if it wasn't correct.
That's fine, thank you. Thank you very much to all the panelists. That was fascinating. And I also wanted to link to the discussions that have been happening at the open-ended working group. And as you know, there has been a discussion there about what the elements of the right to freedom from violence, abuse and neglect in older age should be. And that has been discussed. And things like that the right should cover all forms of violence, abuse and neglect, that it should apply in public and private settings have been raised. But what struck me listening and watching the video, I mean, I was astounded that in the legal research, not one case of intimate partner rape has gone to the courts in that legal research, yet it is the most prevalent form in the sociological and the gerontological research. And one of the things in terms of the right and state responsibility that has been raised is the principle of due diligence, which is very well established in violence against women and girls, whereby the state is responsible for acts of violence perpetrated by non-state actors or by private individuals if the state has failed to take all reasonable steps to prevent, investigate, prosecute, punish, and provide reparations for acts of violence by private actors. And it seems to me that here is a clear example where states are not taking all reasonable steps, if not a single case has gone to the courts. So I suppose that was sort of my comment. My question to the panelists is, in your view, what other elements should there be under this right to freedom from violence, abuse and neglect in older age? Are there other elements that we haven't discussed yet or that you would like to see?
Thank you very much. My name is Xenia Schein-Assen. I'm representing the International Federation on Aging here. And I have a question concerning the definition and data on violence we are discussing here against older women. Concerning the definition, I wonder if there is a globally agreed definition or if we are working with different aspects and thus data might not be so easily comparable. And if this is the case, how can we achieve a globally agreed definition in this context? Because this would be a prerequisite in order to move forward. The second question concerns the data on violence against older women. Is there any data available that compares violence against older persons, older men, with older women, or so as to identify how much is violence against old age and how much is it gender biased? So this would be my question. Thank you.
I have Argentina, and then the lady sitting in the row, please.
Thank you so much, Monica, and thank you to all the panelists. It was very interesting to hear all those different aspects on violence against women. And as you know, we are co-chairs of the open-ended working group on aging that was mentioned by the colleague from Slovenia. We are doing a lot more training in authorities in Argentina at different levels on gender identity and sexual diversity in old age and sexual abuse for older women, etc. But there's still a long way to go. And hearing you, I wrote down some words like need to monitor, and also what the independent expert was talking about, the fact that older women are not visible when it comes to sexual abuse, and the fact that it is not in general strangers that do that, but the persons that are supposed to take care of those older women, persons in centers where they're supposed to be caring for them, family members, etc. And what I see is that there's no visibility of those situations, and also that, of course, the fact that the relationship between older women and sexuality is a bit of a taboo, is completely invisible. So my question was regarding to increasing visibility. How can we increase as states the visibility of this very big problems in order to make sure that those women are protected, and also bearing into account that those women are also sexually diverse, and there's also intersectionality with LGBT women and older women and men, but in this case older women, and that those could be also cause for bigger exposure to violence and sexual abuse. Thank you.
Very complex one. Karen, would you mind if I give the floor to the lady behind you because she was asking? Then you? Yeah.
I know it's her name.
You need a microphone. No, it's because I have a caption there, and she needs you to hear it.
Okay. Excuse me. Okay, I'm Lois Herman. I am Managing Director of the Women's UN Report Network, which is one run, and again, I know many of you in the room. One of our 6 panels this week, we did a PowerPoint on violence against older women. But I want to just make a comment, not really a question, and that is the challenge of getting data or more information on violence against women who are refugees, who are migrants, and I live in Italy, we have so many, or in internally displaced women who are older. And these women kind of fall through the cracks. It's hard to get data. It's hard to get a disaggregation. And an example, I see a nice lady from Ukraine. In Eastern Ukraine, you have so many displaced women. But you hear about violence against men every day, like OSCE, but not about the women. And so that's just an awareness. We broadcast around the world every day, and I see it. And when I see it, I put it up front because we need to be aware. That's a segment of our population, a subset that needs to be considered on violence against older women. Thank you.
Thank you, and now the final word.
Yes, thank you to all the panelists. I'm from UN Women, and I just wanted to say that UN Women is working on older women, applying an intergenerational approach. We're looking at violence against older women, but mainly also in the context of economic empowerment, of women's access to income security, the role of pensions, and the role of the lack of long-term care systems. In this context, we have developed 2 policy briefs. I just wanted to mention that these policy briefs also look at the situation of older women, and they also look at the situation of the caretakers of older women, which mainly are women, and the role of unpaid care work, the role of care work in general, paid care work. So it's an interesting read. It has a lot of recommendations, policy recommendations. So I just wanted to mention it. Thank you. And yes, a question to the panelists: up to which extent you think women's economic empowerment and the discrimination that is faced by women throughout their life then has an impact on the situation at an older age? Thank you.
And I want busy, but very, very short.
Thank you so much, Monica. I would like to thank Sylvia and the rest of the organizers of the panel. I just thought that I should mention, my name is Bisi Adebayo, and I represent the Inter-African Committee on Traditional Practices Affecting the Health of Women and Children. Sylvia knows where I'm going with this. In Africa, the older women are the perpetrators of harmful traditional practices. This is in the bid of passing on, customs and cultures to generations behind them. And I was wondering, they are a resourceful group, very well respected. They are also very, very resourceful within the family, maybe not so resourceful within the general, society, but within families, we know, we've heard about what they do, what grandmas do, the role they play in terms of even instructional and disciplinary roles, and caring as well. So how do we, I don't know what, any of the panelists have been doing in terms of enlisting this group as agents of change, because they are a resourceful group. So we can also turn them to, agents of change to, improve situations and improve, the conditions within the society. Thank you. Any of the panelists?
Now we're going to give the floor back to our panel. I'm going to start by His Excellency, the Ambassador of Montenegro.
Thank you. Very short some remarks. Thank you, panelists, really for very thoughtful and with different aspects, and for questioning comments more than question and contribution from audience. For me, that what colleague from two issues, colleague from Slovenia mentioned is permanent question: what we can do really more for in framework of Human Rights Council and generally UN, but Human Rights Council as a main organ for human rights. We have this very often, even maybe some events and etc. Concerning different aspects of older person, but I mean that we need, and this item deserve more space in program and agenda of Human Rights Council. And maybe we as a group of friends can do also more pressing bureau and to talk with the President of Human Rights Council to find some possibility. If that's not possible towards next session in September, but let me see and plan some in agenda for next year really, to have maybe some item in regular session on this issue. What not happened. We know relevance always on special events or different activities which we provide during the human rights session, but this really deserves something more. And I again, we express that talking about after last year visit of our dear distinguished special representative, and very, really valuable for my country visit. And we committed in some manner, I must say, in Montenegro, and we expressed that last year also during some events and talks, the thinking and pushing that talks on the possibility on binding instruments of this. I really would like to see that as a live issue, not as some occasional expression of thoughts. But let we do, because there are several in framework of human rights issues as human rights and business, and human rights and some other, but there are not, and much more even, I mean, present talking about the possibility of some new binding instruments, but not this hour. Let's push also that. Thank you.
Thank you, Monica. Following what the ambassador was saying and what Slovenia was asking, I guess the independent experts' role regarding older person can be really can actually have an impact on the ground. Besides that, I was thinking that this is one issue that you don't usually hear during universal periodic reviews recommendations, right? So it's something that maybe we can actually start including with more attention, and this is like a chain, one like a domino, one start and the other follows. We work like that usually. the one that has an idea, you have to grab it and use it. So, it was a really good question, or at least a really good comment, because at least they got thinking what else we can do. Someone asked or said something about how can we engage or make our states, our governments to pay more attention to this issue. And, probably works the same way everywhere. You usually need a heartbreaking story to get people to pay attention and to start talking. Sadly, we had these kind of stories in Uruguay, and I have to tell you that they actually started off many, not many, but at least some campaigns, some attention, to the very small level of families starting to pay more attention where they put their elderlies. I mean, in which kind of house, retirement house they were living, how good that house or retirement home, whatever it was, what the conditions of those persons that were, even with the family itself, how they were treated, so maybe it is true that even though we can take some steps here in Geneva or even New York or in these great places, there is definitely a need to pay a very, how we say in economics, like a micro, a micro approach to the problem, starting in your own country and in your own home. Hearing what Professor Ferreira-Alves was saying about what constitutes abuse, I gotta tell you, I did speak to my grandmother and my grandfather in not a very nice way many times. So somehow I was also, a little bit of an abuser. And it's true, again, that with education, everything starts there, right? So you need to actually, yes, keep on nailing on the children's mind that we need to pay attention to the older person in general, and with this, somehow with this multi-dimensional measures, probably will move forward, but again, regarding at least what we can do here in Geneva, maybe the group of friends can actually, for the next UPR review, encourage countries to make some recommendations regarding the adults, right? Thank you.
I may second, complimenting my friend's colleague from Uruguay, this exactly that she added that what was in my thoughts. We can do as, I can say on name of Montenegro that we, in our commitments, that will be praxis, and we as a group of friends, we can do that, starting to be more visible during the UPR cycles. That's in the recommendation, as that is for many other important issues. And we will start that from next year cycle for sure. Thank you.
Any reactions?
Oh my God, my fellow sisters even gone. The one who raised the question, BC. I wanted to say that in terms of the question that she raised as older women perpetuating some of the violence against women, I've had a chance to work with women that are actually involved in the FGM, female genital mutilation, in Kenya. And we went, and the issues they raised were that they are paid to do that job, and that's their source of income. And so if there was any opportunity where they can be introduced to other economic opportunities, they would not actually do that. But they were fully aware that what they were doing is actually violations of human rights, and that they were inflicting pain on children, because during the time that the whole thing happens, children run away, they go hiding. So even they were aware about that, and they said if only we can do other things, then we can definitely stop this. And others had already even given up, they had stopped doing that. And in case of issues like to do with child marriages, I've seen where I'm coming in Zambia. It's also something to do with the policies and the education and the awareness that this is not the right thing. And a lot of women now are involved in actually advocating for the rights of children, because when people are involved in that, we've seen young people are running away from marriages. They have seen that other people are being prosecuted because that is not right. So once it is introduced to them and they start to learn about it, they are involved in actually bringing awareness and the education. And even in other countries where I've been, it's something that is on the ground and it's really being advocated for. I wish Peace was here.
We often organize events with her on those issues, and we will make sure she gets your message. Thank you. Professor?
Just a few comments. Thank you for the questions, and thank you for the work of the ambassador and Ambassador Milorad. Thank you for about your question, if I am planning to improve my sample, I just want to know, yes, it is a very small sample, but I trust that what I got is valid, but obviously, so what we found is not it is not something about that we. It is not something that we should minimize. So it is. They are signals that seem very important, and many times we think that if we improve our samples, things become very different, and many times it is not the case. But sure, you have some reason. So I don't know if
we have another
press. Okay, yes.
We talk with them in the corridor and follow the stuff.
I mean, very quickly, just a question on whether there is a global agreed definition on violence against older women. I don't think so. We don't have that agreement across a formal agreement. In our database of WHO's database, we have data from violence against older women from 56 countries currently. But when we look at what they measured in terms of violence, it's all very different. So there is not agreement. And one thing we just did a few months back to address this is we convened a global consultation, an expert consultation, to recommend what would be the domains that needs to be measured in the umbrella of that concept of violence against older women. And the recommendation from this group was to focus on 4 domains: physical, psychological, sexual, violence, and also neglect or abandonment. The group also discussed, thought the 5th domain would be the financial, but it would be very, very difficult to measure to it. So now the current recommendation is these 4 domains to be measured across the countries, across the survey programs, and we are working to improve this measurement and finalize, hopefully, all together with the community here as well. Thank you very much.
And Susan, while we are kicking it out of the room, Susan, the president of the international network that helped us to bring us together all here.
Of course, I want to say thank you to all of you, to our Madam Moderator, our panelists, and the group of friends, and thank you for keep coming and being here for us, both the Human Rights Council and also in New York, the Open-Ended Working Group on Aging. Some of the questions that were asked probably could have had more broad responses if we had more time. With respect to hearing the voices of older persons themselves, there's work done by Help Age International for many years. They've been working in our own voices. There's one one report, the Global Alliance on the Rights of Older Persons just did a report where older persons themselves were expressing what violence and abuse, etc., meant to them. In learning more about this, we're going to a meeting in a few moments, as a matter of fact, that the Office of the High Commissioner of Human Rights is holding on a strategy for us to move forward towards a new convention. And thank you very much, Mr. You're number one on my list. Let's all visit. And we're going to that meeting to discuss a further strategy, which we have to constantly do, and we want to hear from any of you who've had experiences with perhaps with other treaties and other issues to help us move forward. We are also having another side event during the capacity building on July 10th, where we'll be talking about ageism and human. Thank you. My backup. See how nice it is here? And human rights education. So thank you all very much. And of course, my good friend José and Ursula, I'm sorry you didn't get to speak, but another time. All right, thank you. Bye. Thank you.